we need to make sure we have a better grasp on the accuracy of the data before we put projections out there.
Tonight, calls for Canada to predict COVID-19 numbers after Ontario releases projections.
Could spread like wildfire through the prisons because of the poor hygiene, because of the inability to practice physical distancing.
Concerns over inmates contracting the virus.
Every day I watch my nurses that I work with work really hard, and especially right now, working so much harder to put processes in place with COVID-19.
And a Yukon group beads fireweed pins for frontline workers. Good evening, welcome to APTN National News. I'm Daryl Stranger. Ontario released projections of COVID-19 cases and mortality rates today, and they are sobering. If measures had not been taken, there would have been tens of thousands of cases by the end of this month in Ontario alone. And as Todd Lamoran reports, mortality rates could have also been much worse, but they are still troubling.
There are currently 67 deaths in Ontario, a number expected to quickly increase.
Even within the short 30-day period between here and now, you'd be looking at up to 6,000 deaths. Thankfully, there have been some actions taken, and this leads us to a current estimate of about 1,600 deaths.
Dr. Peter Donnelly says the pandemic may last up to 2 years. And again, if nothing had been done, there could have been 100,000 deaths over that time.
Everything that already has been done stays in place. All of the other measures which are being considered, put in place, that I think we could reduce the death toll in Ontario to somewhere between 3,000 and 15,000.
Ontario Premier Doug Ford called the numbers stark and sobering and wants to keep the mortality rate as low as possible through social distancing.
Is a life worth a picnic in a park? Is a life worth going to the beach? Is a life worth having a few cold ones with your buddies in the basement? The answer is no.
The Trudeau government has been pressured to make public projections for the country as a whole.
Morning, everyone.
But he isn't ready to do that yet.
People are wondering how much longer is this going to last, how many Canadians are going to be severely affected. These are things that we will be sharing with Canadians, but we need to make sure we have a better grasp on the accuracy of the data before we put projections out there.
Meanwhile, Trudeau announced that food banks are under pressure and will get more support.
I'm announcing that the government will provide $100 million to meet the urgent food needs of vulnerable Canadians, including those living in Indigenous and Northern communities. This money will help ensure that organizations can buy and deliver food to those who need it the most.
The Prime Minister also said Quebec had asked for military assistance, and it will be sent to northern and remote communities to install tents and medical infrastructure. Todd Lamoran, APTN National News, Ottawa.
Now let's take a look at the national number of cases and how many each province and territory have as of this morning. The number of COVID-19 cases in Canada sits at 11,747. Quebec leads the country with the most cases and has over 5,500. Ontario has the next highest at 3,255. And BC ranks third highest in Canada with 1,121 cases. And as you just saw, Nunavut remains the only jurisdiction in Canada without a case of COVID-19. 314 tests have been completed, 98 have come back negative. Today, the territorial government was joined by Nunavut Tungavik to explain a new program to help feed Nunavut youth and elders. Both groups are kicking in $1 million. Tungavik's president explains.
We know when bodies have the right types of good nutritious food, they're in a better position and they're to boost their immunity. And we want Inuit to be in the position where they can fight off the virus if it comes to our communities.
The Algonquin First Nation of Long Point in northwestern Quebec says they need more policing to enforce measures to prevent COVID-19 from spreading. The isolated community, located over 600 kilometers from Montreal, is particularly vulnerable to the pandemic. Tom Fenario reports.
Hillary, Andrew, Isaac.
In 2014, Kathleen Jerome Rogers let APTN into her home while she cooked dinner, which in this house is no small feat.
Right now there's about 12 of us living here.
Nearly 6 years later, not much has changed in Long Point First Nation.
There's one home, I know there's 17 people in it, and there's also a good percentage of the community. There are 2 families per home.
Chief Steve Mathias knows that his community is very vulnerable if COVID-19 makes it in. Aside from overcrowded homes, they have a high rate of diabetes. They have called the state emergency and created a checkpoint to manage people's comings and goings, but don't have the security to enforce it.
Dependent on the Sûreté du Québec, on the SQ, the provincial police, and in the last, I would say, the last 7-8 years, they're not very present in the community. They were only coming on call, and they would take over 2 hours.
Earlier this week, Mathias called on provincial and federal governments to provide more public security to enforce COVID-19 pandemic measures. He was unable to secure 24-hour policing. But Mathias says Quebec is committed to providing 1 SQ patrol per day, while the federal government has agreed to pay for the services of a private security firm. With COVID-19 cases increasing in the Temiskaming region where Long Point is located, Mathias says community members are starting to realize its severity.
We're just trying to do our best and our utmost to make sure that we keep everyone safe.
Tom Fenario, APTN National News, Montreal.
First Nations in Manitoba are still COVID-19 free. But health officials are asking band councils to prepare locations where patients can be isolated. If they can't do that, patients would have to be flown to a Winnipeg hospital. Indigenous patients with respiratory issues will be considered high risk. The first on-reserve virus testing site is in the works, but no location has been set. Manitoba's public health officer says small communities with a positive case won't be identified to avoid bullying. And there has been a major development in the ongoing battle for Grassy Narrows in northern Ontario. A deal has been announced that will see Canada commit $19.5 million for the design and construction of a Mercury Care Home Centre. A framework agreement was signed on Thursday by Grassy Narrows Chief Rudy Turtle and Indigenous Services Minister Mark Miller. For decades, a Dryden pulp and paper mill dumped tons of mercury into a river that sent the poison downstream to Grassy Narrows. Still to be decided is how much Indigenous Services will fund the operations and services of the new facility. Chief Rudy Turtle had this to say.
But we are in the process of securing another $68 million, and that still has to go to cabinet for approval. So we're hoping that the ministry doesn't back down on his word, but so far we're very optimistic. He's kept his word all along. This new minister, Mark Miller.
The Métis Nation of Saskatchewan has secured nearly $3 million in emergency COVID-19 relief funding for its communities. Priscilla Wolf has the details.
The Métis Nation of Saskatchewan says they will be giving funding to Métis communities in the province to help with essential supplies during this COVID-19 pandemic. M&S President Glenn McCullum says they've secured $2.8 million from the Government of Canada as part of the $305 million going to Indigenous communities.
This is the first time in our history as a Métis Nation, government in Saskatchewan, that we had capacity to be able to react or deal with emergency situations like this pandemic. And it's very good to be able to have those resources to be able to deal directly with our government, which is made up of our local president, which is our over 100 locals in our province.
The money will help communities to deal with the pandemic. They will also provide personal protective equipment, help with childcare, and help households that are facing financial difficulties.
We have mobilized a task team headed by the Ministry of Health for Métis Nation, and we have considered all levels of support, immediate support for Métis citizens who perhaps are experiencing some financial barriers or financial pressures.
Each region is assessing the needs of each household. Métis citizens should contact their regional director to apply for household funding. even if they haven't registered as a Métis citizen yet. Childcare funding is only for registered members, but registration is still open. Priscilla Wolf, APTN National News, Saskatoon.
It's time for a short break, but still to come, the federal government announced it's examining options around the country's prison population. Starting on the east coast, +1 in Charlottetown and 0 degrees and snow in St. John's. -8 in Kuujjuaq and -8 in Nain. +6 in Quebec City and +6 in Val-d'Or. +11 in North Bay and +15 in London with sun. +8 in Timmins and +6 in Thunder Bay. -9 in Churchill and -3 in Norway House. -4 in Winnipeg and sun, and -4 and sun in Barons River. -4 and snow in Yorkton and -6 and snow in North Battleford. -5 in Stony Rapids and -5 in Buffalo Narrows. Welcome back. Prime Minister Justin Trudeau says that measures are being taken to protect inmates in federal prisons from contracting COVID-19. Thousands of them are Indigenous and waiting as the government weighs options like early release to protect them. But is it too late? Lindsay Richardson explains.
Incarcerated Canadians, a group clearly heeding orders to stay indoors. But as cases of COVID-19 infiltrate correctional facilities countrywide, those on the inside are reaching out.
And with this virus thing, they don't do no cleaning. They pretty much laugh at it. We clean ourselves, and we don't have no masks, no gloves, none of that.
The institution is telling the courthouse that they're giving us temperature checks twice a day. And never once have I ever been getting a temperature check. It's a bad place to be right now.
Across Canada, activists mobilized to inform prisoners of their rights while calling for exceptional measures, even early release for low-risk offenders at high risk of contracting the virus.
You know, as the medical professionals are saying, when this takes hold, it could spread like wildfire through the prisons because of the poor hygiene, because of the inability to practice physical distancing measures that the rest of us are doing outside, the inability sometimes to even engage in the hygiene measures that are required within individually.
After the first cases were confirmed at Port Cartier, a maximum security facility in Quebec, Correctional Services Canada says they took immediate action, including deep cleaning, masks for workers, screening and temperature taking, physical distancing, and suspension of all visits and temporary absences. Inmates who contacted APTN, however, say they were forced to clean potentially contaminated cells without protection, aren't receiving regular showers, and have issues accessing medical help.
It's shameful, and we should be rectifying this.
David Milgaard spent over 2 decades in the pen on a false conviction. Now a prisoner's advocate, he says in no uncertain terms, inaction will be fatal.
There is no safety net there. There is no possibility that you're going to survive. I mean, this situation is, it's a time bomb, and they know it.
With countries around the world fast-tracking releases, this week, Canada asked the Powers and Correctional Services to probe available options. Public Security Minister Bill Blair said in a statement, "This pandemic continues to evolve, and we have been clear that our response will as well." Despite welcoming this development, advocates say there's an important distinction to be made. Canada cannot compel individual governments to follow suit in provincial jails, which house low-risk offenders serving under 2-year sentences. These institutions are authorized to use lockdown, even solitary confinement, as preventative measures, much to the concern of corrections lawyers.
And nowadays, we're talking a lot about the problems, the psychiatric issue and the psychologist issue that comes with putting people in segregation, which means leaving someone in his cell for 23 hours on 24 for a couple of days, weeks, or months can have disastrous impact on his mental health, and this has been proven by many psychiatrists.
Gaulmier says 15 consecutive days in SEG constitutes cruel and unusual punishment. 2 letters written by the association she belongs to ask for exceptional release of inmates who are serving less than 6 months, over 70, have a chronic illness, or who are pregnant. It's estimated nearly half of the people in jail awaiting trial will never face a conviction. For Pate, restorative justice in the era of COVID-19 means examining individual roles and contributions.
Really what they need to be doing is limiting the numbers of people in the prisons, encouraging attorneys general in the various provinces, territories, and federally to encourage police officers, prosecutors, and judges to exercise their discretion to not jail people if it's not required for public safety.
Milgaard says any government decision should be guided by compassion.
No one has the right to give them a death sentence, Lindsay. No one has the right to disqualify people from life.
The correction system is built to protect the public. It remains to be seen whether inmates receive the same protection as sickness moves into the cell block. Lindsay Richardson, APTN National News, Montreal.
A 4th inmate at a women's prison in Kitchener has tested positive for COVID-19.
The institution is calling our 1-800 number. The women in there are terrified.
Prison officials say the inmates who are ill have been immediately put in self-isolation and stricter cleaning routines have been put in place. The union representing prison guards says staff are given personal protective equipment when necessary. However, many advocates are worried the virus will continue to spread. It's time for another break, but coming up, one group in a Yukon community found a way to stay connected with each other during this pandemic. Stay with us. Making our way west now, -3 in High Level and -4 in Peace River. -2 in Calgary and -4 in Edmonton. +6 in Kamloops and +9 in Campbell River. +3 in Smithers and -1 in Fort Nelson. -5 in Rock River and 0 degrees in Whitehorse. -8 in Yellowknife and -8 in Fort Simpson. -8 in Inuvik and -12 in Colville Lake. -13 in Repulse Bay and -14 in Baker Lake. -11 in Clyde River and -11 in Arctic Bay. Welcome back. Self-isolation and physical distancing can be difficult for many people during this pandemic. But one group in a Yukon community found a way to stay connected with each other, and for a good cause. Chris McIntyre has more.
Fireweed symbolizes strength, healing, and renewal, and the term hero describes a person admired for courage or noble qualities. That is why community members in Dawson City decided Fireweed Heroes was an appropriate name to call their beading group. Started by Kyla Papadenik, the group has been creating fireweed flower pins to distribute to frontline workers.
You know, every day I watch my nurses that I work with work really hard, and especially right now, working so much harder to put processes in place with COVID-19. And yeah, it was just a thought, like, how could we give back?
The group was formed in late March through social media. What started as a group of a few local friends quickly grew to close to 200 members spanning across the Yukon.
A lot of people in other Yukon communities have contacted me, and so we have people in Whitehorse doing them, people in Mayo doing them. Yeah, and they've just kind of either posted on the page or just sent me a message.
Papadenik's short-term goal is to have 100 pins from Dawson. She currently has 20 pins ready to be handed out. To practice infection control, each pin will be sealed in a bag for 5 days prior to being distributed.
Come through the skin. Give it a good tight pull.
As frontline workers continue to work through this pandemic for the community, the Fireweed Heroes will be beating these pins to show their appreciation.
It's really important for me to acknowledge, you know, all the workers in different areas out there and make sure that they understand that they're supported. So when they have days that are uncertain, because I think we're all feeling like this is a real time of uncertainty, or fearful days, that they have something to show that, you know, community members are really behind them.
Chris McIntyre, APTN National News, Dawson City.
Residents of the Northwest Territories are now working and educating from their homes. With that comes a big increase in internet use. But many remote communities do not have high-speed internet and pay even more for over-the-limit charges. APTN's Charlotte Moore-Jacobs chats with one parent calling for equal access.
On a good day, the internet speed and cost in the territories would shock most Southerners. And during a pandemic, when residents are working from home, many alongside their kids, there's a lot of room for improvement. Mila Nakiko created a petition for the only internet service provider in the north, Northwest Tel, to waive overage fees for every community.
At the beginning, that it would help promote social distancing, like physical distancing. It would help people stay in their homes and stay connected.
In roughly 2 weeks, it's gained about 700 signatures.
I know friends that live down south, and they would be like, I would love to video chat with my auntie in Toledo or Covell Lake or something, but the internet services are not good enough. We've been having virtual beading circles, but a lot of the ladies in the smaller communities can't participate in those because their services aren't good enough to be able to stream a chat for an hour.
Northwest Tel has waived fees for those in Yellowknife, Fort Smith and Norman Wells, and increased caps for other communities. Yes. But Nakiko is calling for better internet speeds and costs for everyone.
Somebody in Fort Liard is in the exact same position as somebody in Toronto. We need to be able to access the internet and have the same services so that we could all continue working, continue supporting our kids in their education, and for our mental health, and and definitely promotes social distance.
As an artist, Nakiko has been creating original social distancing campaign posters, like this one, called "Our Camp is Our Home." Problem is, information on how to stay safe like this isn't making it to the communities.
I think it's not. It doesn't seem like it's a real thing yet in some of the communities. Somebody just walked into one of my relatives' houses in Fort Simpson, just just walked in to visit, and just a few days ago, and I was just like, oh my God, we need to put signs, put a sign on your door, just saying no visitors, please, just call ahead, because people are really not taking the recommendations seriously as some people.
On April 2nd, 2 more positive cases of COVID-19 were announced in the NWT, bringing the total up to 4. For Nakiko, she plans to take a break from the internet and stay safe taking her kids on the land. Charlotte Moore-Jacobs, APTN National News, Yellowknife.
That's your APTN National News for this Friday. Stay up to date with the very latest on COVID-19 by visiting our special page, aptnnews.ca/COVID-19, and by downloading the APTN News app. I'm Daryl Stranger. Thanks for tuning in. Have a safe and healthy weekend, and remember to wash your hands.